Welcome back to AISOD's Telemedicine app. This is part two. You have to go to part one to understand more, but let's go on part two where we are going to show you the web version. Actually, this is the web version of the telemedicine app demo, the one that we just built at ISOD. It's a quick one. Let me see. It's an app addressing solutions related to healthcare and medications and stuff like that. So the few features that we have are quite few because it's just a demo that we're showing you, but we can build more features and more stuff depending on the request, and we can really go further into what we already have today. So here is what we have. Inside the app, you can be able to search for different specialists, for different doctors, for different cardiologists, whatsoever it is that you need according to the health situation that you find yourself. And inside the app, as you guys can see, it is we have doctors, we have different like urgent care. We have different types of care, and we have a place where you can find the doctor, and then we have a place where you can make the appointments, or you can even make the appointments within the profile of the doctor, and then you can also search according to what the doctor does. You see, we also have medical care, medical health or urgent care or different kinds. You can search for whatever you want in the app and you will find it there. Now, when you search, you can also search a doctor by name. And after you find the doctor that you're looking for, you can book an appointment. Let's say you already know Dr. Jennifer, so you already have bookings with her, or you want to know more about her, you can see about her, you can see the hours that she's available, and then you can also see the education, the things, how what she learned or what she knows, and then you can book an appointment. And when you're booking the appointment, you can put the date and the time that you want to be in presence or online or virtually, it depends. And then you explain a bit about the situation that you are facing. Oh, it's so bad, I need this, and that, and then you confirm the booking. So just because you booked, now it's concluded you booked, but just because you booked doesn't mean that you've paid. So you see, the booking is there, but there is no payment or it was not paid. So you need to make a payment. So you click and it will take you to the place where you should input the information, your card information. And with your card information, you'll be able to do the payments with your card. It can be debit card or credit card, any kind of card. You can just put the details there. Here is it's asking you to put the expiry date, and then you put the CSV number of your card that will allow you to allow the app to deduct the money, and then voila, it is done. Appointment is confirmed, the payment was done. Now you can go back to the bookings. See, then you can see this is a new booking you did, and then these are the past bookings that you did before. So you can see that the bookings are paid. So they're just waiting for the day or the time that you have to see. Look, this is your profile. This is your profile. More information about you is there. Then you can even change it to another language. Imagine you speak Spanish or you speak another language, you can just change languages. Just that now we only have English and Spanish, which are international languages. We can add more languages depending on the request of the clients. You see, when you change it to one language, everything about the app will be in that language. And you can be able to communicate. You can search for doctors. You can do almost anything. So this is what this app can do. You can check a lot about who is there, who is not there, and who are they for real, what they study. Because sometimes you don't know what they know. You understand? So you need to know what they know so that you can be able to address your situation to them, and they can address your situation and solve it. So this is the app, and we have call us, get back to us, and we'll be able to give you more information. But you guys know that part one is already having all the pros and solutions that the app is providing. Just go to part one and you'll be able to get more information about that. You get more information about what you're trying to plan, what you're trying to do, and the insights, how much money you'll be able to make if you own this kind of app. We are talking about more than 2.4 billion that you can do in Africa, copying what they did in Teladoc. But if you bring it down to you or to us, you can be able to do 12 million. But you see, something you need to know is what exactly can the app do? You understand? You need to know these things, which are the booking of appointment, payment integrations, offline support, local language interface, and you can really do much more than that. You understand? We can add more functionalities, but the demo that we have today is only for these small functionalities which are core, which are important. Meaning, without these functionalities, you won't be able to make so much money as we stipulated before. But with these functionalities, you can be able to do so much more. So there is the web version, and then there is the mobile version that you can use. Maybe if you're using iOS or Android, you can just use the app and book, do the same thing that you could do or that you can do in the computer. Because some people, you're at work, maybe you see, you may book from your computer, but if you're not at work, or maybe you don't have a computer, you can just use your phone. You understand? And both the doctor and you can have access to the application without having a computer. Or if you're at work, you can use your computer and you'll be able to have access to everything that's happening there. But reach out to us. We are ready to develop this further. If you need such an application, we can bring it to you. We can do it for you. We can finalize it for you, and we can also help you generate funds, actually generate money using this kind of application, because we are so good in what we do that we believe that when you come, imagine we already have a prototype, meaning that you can just get from where it is, and increase it and make it better. Like right now, we are also having different payment gateways in Namibia that you could leverage from and integrate it in your application. We already use one of them, which is called Pay Today from NetBank, and it works very well. It works seamlessly, and you guys can actually use it in your appointment confirmations and get paid straight into your account without having to hassle or try to get international payment gateways. This one is from Namibia and it's also international. And if you're not in Namibia, you can also get another one. You can use Flutterwave, any of them. You understand? So you can add any language in Africa or out of Africa. We can do and add more functionalities. It all depends on you. So call us today, as you guys can see that 12 million is a small money that you can make, to understand, because the app already did more than this. You understand? It's an app that already did more than this, and in Africa this need is there, big time. I mean, strong. So reach out to us and you guys can do more than 12 million as an annual revenue if you are really serious with the application. So thank you so much and have a wonderful day. I hope you will reach out to us and get more information, or you can also reach out to us to learn how to do these things. We also offer courses and teach on how to build such software solutions. Have a good day and a wonderful day. See you. Thank you.